Okay, so you sent over a really fascinating set of stuff on AI in healthcare, and we've got some pretty lively Reddit discussions from both like healthcare providers and tech people.
Mm-hmm.
We've got a really insightful article on how AI is like already being used in clinical situations,
Right.
and then to like top it all off, excerpts from this European Parliament study
Yeah.
that gets into like all the details of the implications of AI in healthcare.
Mm-hmm.
So it looks like we're really aiming for the full picture here, not just what AI can do in healthcare, but how it's actually like impacting things and what it might mean for the future.
Yeah, it's a great mix of sources, and it
Mhm.
really highlights the fact that AI in healthcare isn't just some distant science fiction concept, you know?
Right.
It's already happening.
Yeah, that's what I thought too. I was reading this thread, and an ICU nurse was suggesting that people just play around with GPT-4
Mm-hmm.
to get a feel for what AI can do, even though it's not a medical tool itself.
Right.
It really kind of brings it home that this tech is like here now,
Yeah.
and we need to understand it.
I think that's a really smart approach because sometimes all the hype around AI makes it seem almost magical.
Right,
And getting hands-on, even with something like GPT-4,
right.
helps you see the potential, but also the limitations.
Totally. And speaking of real-world applications, some of these examples in the Airbyte article were mind-blowing.
Yeah.
They were talking about a system called Analytic
Mm-hmm.
that's being used to analyze medical images.
Right.
Can you imagine AI helping radiologists spot these tiny little details
Yeah.
that could easily be missed by a human?
It's already happening.
Wow.
And that's just one example.
Yeah.
We've also got systems like the Page prostate detection system that can analyze biopsies to detect prostate cancer.
Right.
So the potential for AI to improve diagnostic accuracy
Yeah.
is huge, and that translates to earlier interventions
Mm.
and better outcomes for patients.
It's almost like having a second pair of incredibly sharp eyes,
Yeah.
working alongside doctors. But here's the thing that makes me a bit uneasy.
Okay.
We're talking about incredibly sensitive information.
Right.
What about the security of all this patient data that's being fed into these systems?
Yeah.
I mean, the European Parliament study mentioned some pretty worrying examples of data breaches
Yeah.
involving AI companies.
Right.
It's pretty scary.
You're right to be concerned.
Yeah.
Data privacy and security are absolutely paramount.
Mm-hmm.
If we're going to entrust AI with our health information,
Right.
we need to make sure that information is protected.
Yeah.
And it's not just about preventing breaches, it's also about ensuring that the data is used responsibly and ethically.
It's a lot to think about. And I know some people are also worried about AI like taking jobs away from healthcare workers.
Right.
But the way I see it, if AI can take over some of the more tedious and repetitive tasks,
Hmm.
like scheduling appointments or handling billing, it could actually free up doctors and nurses to
Yeah.
spend more time with patients.
That's one of the key arguments for AI in healthcare.
Yeah,
It's not about replacing humans.
right.
It's about augmenting their capabilities.
Yeah,
Imagine a doctor who no longer has to spend hours transcribing notes or sifting through mountains of data.
right.
They can actually focus on what matters most, which is patient care.
That makes a lot of sense. And there's also the whole area of personalized medicine, which the EU study really dives into.
Uh-huh.
I'm fascinated by the idea that AI could help tailor treatments to individual patients based on their unique genetic makeup, lifestyle, and all these other factors.
The potential of personalized medicine is huge.
Yeah,
It could revolutionize how we approach healthcare, moving away from a one-size-fits-all model
right,
to something that's truly tailored to each individual.
right.
But there are challenges to consider.
Like what?
Well, for one thing, these systems rely on massive amounts of data,
Mm-hmm.
and we need to make sure that data is representative of the diverse populations we're trying to serve.
Right.
If the data sets are skewed towards certain demographics,
Yeah.
we could end up with AI systems that perpetuate existing biases in healthcare.
That's a really important point, and it makes me wonder, how do we even begin to ensure that these AI systems are fair and unbiased?
Right,
It's not like they're human.
right.
They don't have the same capacity for empathy or understanding.
It's a complex issue, and it's one that researchers and developers are actively working on.
Okay.
There's a growing field of research focused on building fairness and transparency into these AI systems.
That's good to hear, but it also makes me wonder, if these systems are making such crucial decisions about our health, shouldn't we be able to understand how they're arriving at those decisions?
Yeah.
I mean, I know this is a big concern in the AI world, the whole black box problem.
You're right. A lot of transparency in AI decision-making is a valid concern,
Yeah.
especially in healthcare where lives are at stake.
Right.
That's why there's this push towards developing what's called explainable AI. These are systems that can provide clear, understandable justifications for their recommendations.
Explainable AI, that sounds promising, but even with explainable AI, wouldn't that require a certain level of technical understanding from doctors and nurses?
Yeah.
I mean, how many healthcare providers are truly equipped to decipher complex algorithms?
You've hit on another crucial aspect, education.
Right?
We need to make sure that healthcare professionals are adequately trained to understand and use these AI tools effectively.
Yeah,
It's not just about learning how to operate the software,
right.
it's about understanding the underlying principles and being able to critically evaluate the output.
So it's a two-way street.
Yeah,
We need to make these AI systems more transparent and understandable,
right.
but we also need to upskill healthcare providers so they can confidently navigate this new landscape. It's a lot to tackle.
It is, but it's a challenge worth taking on.
Yeah,
Because if we get this right, AI has the potential to truly transform healthcare for the better.
I hope so.
Yeah.
As we're talking about all this, I can't help but think back to that Reddit thread where the ICU nurse was suggesting people experiment with the VPT-4.
Right.
It really got me thinking about just how quickly this technology is evolving.
Yeah.
I mean, we've gone from basic algorithms to these incredibly complex deep learning systems in what feels like the blink of an eye.
It's been a rapid evolution, and it's showing no signs of slowing down.
Yeah.
Deep learning is really where things get interesting.
Okay.
These systems, with their intricate neural networks, can analyze massive amounts of data, identify subtle patterns, and even learn and adapt over time.
That's the part that both fascinates me and kind of freaks me out.
Mm-hmm.
I mean, if these systems are constantly learning and changing, how can we be sure they're still making safe and reliable decisions, especially when it comes to something as critical as healthcare?
It's a valid concern. The European Parliament study actually uses the term adaptive AI to
Okay.
describe these systems that can evolve.
Right.
It's a bit like having a medical student who's constantly studying and updating their knowledge.
Yeah.
Except in this case, the student is an AI system that can modify its own algorithms based on new data and experiences.
So we're not just talking about AI following pre-programmed instructions anymore.
Right.
They're actually shaping their own understanding of the world of medicine,
Yeah.
of how to diagnose and treat patients. It's incredible, but it also raises some pretty big questions about control and oversight.
Absolutely, and that's why the study emphasizes the need for robust testing, validation, and monitoring of these adaptive AI systems.
Hmm.
We can't just unleash them into the healthcare system and hope for the best.
Right.
We need to have safeguards in place to ensure they're operating safely and ethically.
It's almost like giving someone a driver's license.
Right.
You want to make sure they've passed all the tests and know the rules of the road before you let them loose on the highway.
Yeah.
Except in this case, the highway is the entire healthcare system,
Yeah.
and the stakes are incredibly high.
That's a great analogy, and it highlights the importance of not just focusing on the technical capabilities of AI, but also on the ethical and societal implications.
Right.
We need to have open and honest conversations about the potential risks as well as the benefits.
Okay, so we've got these powerful AI systems that are constantly evolving, and we need to make sure they're safe, ethical, and transparent. Where do we even begin to tackle a challenge of this magnitude?
Well, the EU study lays out some recommendations that I think are a good starting point.
Okay.
Research is crucial. We need to continue investing in research to better understand the capabilities and limitations of AI in healthcare,
Mm-hmm.
particularly these more advanced systems like deep learning and adaptive AI.
It seems like we're just scratching the surface of what AI can do in healthcare.
Yeah,
But the more I learn about it, the more I realize how much we still don't know.
right.
And it's not just about the technology itself, it's about the human element. How do we integrate AI into healthcare in a way that benefits both patients and providers?
That's exactly right. And that's where the study's emphasis on education comes in.
Okay.
We need to educate healthcare providers about AI, its potential benefits, its limitations, the ethical considerations, and how to use it responsibly and effectively.
I remember reading a comment in one of the Reddit threads about how some doctors are hesitant to use AI tools because they don't fully understand how they work.
Right.
They're worried about being replaced by machines or about making a mistake because they blindly trusted an algorithm.
Those are valid concerns, and it underscores the need for education that goes beyond just the technical aspects.
Yeah.
We need to address the anxieties and build trust between healthcare providers and AI systems.
It's about empowering healthcare professionals to use AI as a tool to enhance their own expertise, not to replace it.
Exactly.
But what about the patients? Do they need AI education too?
Yeah.
I mean, most people are probably clueless about how AI is already being used in their healthcare.
I think patient education is absolutely crucial. If you go to the doctor and they're using an AI system to help with your diagnosis or treatment plan, You have a right to know that, and you have a right to understand what it means.
It's about transparency and informed consent, making sure patients are active participants in their own healthcare, even when AI is involved.
Exactly. And it's not just about understanding how AI is currently being used. It's also about being aware of the potential implications for the future. For example, the study touches on the concept of generative AI,
Okay.
which can create new content like synthetic medical data.
Generative AI, that's the one that can write poems and compose music, right?
Yeah,
I didn't realize it was being used in healthcare.
it's still early days, but the potential applications are vast. Imagine using generative AI to create personalized health education materials tailored to an individual's specific needs and learning style,
Wow.
or using it to generate synthetic patient data for research, which could help us develop new treatments and therapies without compromising patient privacy.
That's incredible. But like any powerful technology, there are potential downsides. If AI can create fake data that's indistinguishable from real data, what's to stop someone from using it for malicious purposes?
That's a valid concern, and it highlights the need for clear ethical guidelines and regulations around the use of generative AI in healthcare.
Yeah.
We need to make sure it's used responsibly and for the benefit of patients, not for profit or manipulation.
It seems like every time we uncover a potential benefit of AI, there's a corresponding challenge that we need to address. It's a constant balancing act.
It is, and that's why it's so important to have these conversations, to bring these issues to light, and to involve a wide range of stakeholders in shaping the future of AI in healthcare.
Speaking of involving stakeholders, I remember this study mentioning something called the AI divide. What exactly does that refer to?
The AI divide is a term that's used to describe the inequalities in access to AI technology and expertise.
Okay.
It can exist between countries where some nations have significantly more resources and infrastructure to develop and deploy AI, and it can also exist within countries where certain communities or populations may be left behind.
So it's not just about making sure the technology is safe and ethical, it's also about making sure it's accessible to everyone, regardless of their socioeconomic background or geographic location.
Exactly. If we want AI to truly benefit healthcare, we need to make sure it's not exacerbating existing inequalities.
It's a lot to think about, but it's clear that AI is already having a profound impact on healthcare. And that impact is only going to grow in the years to come. And while there are certainly challenges to navigate, there's also immense potential for good.
I agree, and I think it's important to approach this with a sense of both caution and optimism. We need to be mindful of the risks, but we also need to be excited about the possibilities.
It's amazing how this deep dive has really opened my eyes to the sheer scoop of AI in healthcare.
Yeah,
It's not just about improving diagnoses or streamlining administrative tasks.
okay.
It's also about understanding the human side of health, those intricate connections between our physical well-being and our emotions.
Uh-huh.
I mean, remember that Reddit thread where someone mentioned Takotsubo cardiomyopathy?
Yeah, the broken heart syndrome.
Right.
It's a fascinating condition, and even the name itself is so evocative. It really captures that idea that intense emotional stress can manifest physically.
Exactly. And the way the user described it, the affected heart actually resembles an octopus trapped in a pot.
Oh, wow.
Hence the name Takotsubo from the Japanese words for octopus and pot.
Interesting.
It's kind of like medical humor, but it got me thinking, could AI play a role in understanding and even treating conditions like this where emotional factors are so intertwined with physical health?
It's an intriguing question, and it points to a whole new frontier in AI research.
Yeah,
We're already seeing AI being used to analyze things like facial expressions and voice patterns to detect signs of depression or anxiety.
it's almost like AI is learning to read our emotions,
Mm-hmm.
to understand not just what we say, but how we feel. And if you can do that accurately, could it potentially identify people who might be at risk for stress-related illnesses like Takotsubo cardiomyopathy?
It's certainly within the realm of possibility.
Wow.
Imagine a future where wearable devices powered by AI can monitor not just our heart rate and sleep patterns,
Right.
but also our emotional state throughout the day.
That's wild.
They could detect subtle shifts in our mood, our stress levels,
Yeah.
and alert us to potential problems before they even manifest physically.
That's both exciting and a bit unsettling, isn't it?
Yeah,
I mean, on the one hand, it could be incredibly helpful to have that kind of early warning system for our mental and emotional well-being.
right.
But on the other hand, it feels like a slippery slope towards constant surveillance. Where do we draw the line between helpful monitoring and intrusive intrusion?
That's the million-dollar question, and it's one that we need to grapple with as AI becomes increasingly integrated into our lives.
Yeah,
Transparency is crucial.
right.
People need to understand what data is being collected, how it's being used, and what control they have over it.
It's about empowering individuals to make informed decisions about their own health data, rather than feeling like they're being monitored without their consent. And it's about having clear ethical guidelines in place to prevent misuse of this technology.
Absolutely. We need to be incredibly thoughtful about how we develop and deploy AI in healthcare,
Right.
ensuring that it's used to enhance human well-being, not to exploit or control us.
This brings us back full circle to that thought-provoking question you posed earlier.
Hmm.
Imagine a future where AI can analyze not just our medical records, but our lifestyle genetics, social media activity, everything to predict health risks and suggest personalized interventions.
Right.
Is this a future we should embrace or fear?
It's a future that holds both immense promise and potential peril. We could see a world where diseases are detected and treated before they even have a chance to take hold,
Right.
where personalized medicine becomes the norm,
Yeah.
and where healthcare is truly tailored to each individual.
Right.
But we could also see a world where our privacy is eroded, where algorithms dictate our choices, and where we become slaves to data.
It's a powerful reminder that technology is a tool, and like any tool, it can be used for good or for ill. It's up to us as a society to decide how we want to shape this future.
And that's why it's so important to stay informed, to engage in these conversations, to
Yeah.
ask the hard questions, and to demand that AI is developed and used responsibly, ethically, and for the benefit of all humankind.
Well said. So to our listener, we leave you with this. As AI continues to evolve, stay curious, stay engaged, and keep asking those hard questions. The future of healthcare and indeed the future of humanity depends on it.